My name is Richard Turner. I'm a forensic psychiatrist. I went to college at Howard University, got a master's degree at Temple University, African American Studies. Then I went to medical school at LSU in Shreveport, did my residency and fellowship at Tulane University here in New Orleans. Right now, I'm an assistant clinical professor of forensic psychiatry and general psychiatry. So I work at a forensic hospital right now, an outpatient clinic for severely mentally ill patients that are high medical risk, but also at the local parish prison here in New Orleans. We don't have counties, we have parishes.
Yeah.
So Orleans Parish Prison, Justice Center, that's what they call it now. So
Our first question is, what is schizophrenia?
it's a psychotic disorder. So what it means is psychotic disorders have two kinds of symptoms. There's positive symptoms and negative symptoms. The positive symptoms of schizophrenia are the things we think about, people saying they hear voices, other people don't, people getting paranoid, having weird like delusional beliefs, like people are in love with them or people are after them or people are poisoning them. There's other stuff like they have they'll see stuff, they'll like see stuff you don't see too. They'll have stuff going on inside, like they'll be responding, thinking you're talking to them, but they're hearing something inside their head that you don't even know about, or they're responding to something they're experiencing. So sometimes they'll see stuff like in the room, or they misread your face to mean you could be looking neutral and they take it as hostile, and you could be looking hostile and they take it as kind. Or so it's apathy, like people who just don't have any motivation. A lot of them have no interest in socializing. If you ask them a question, they can't elaborate. Like if you ask them, what do you think about a movie? They'll be like, good. It's good. Movie's good. And you're like, what do you like about it? The movie's good. Or some of the other things would be like disorganized speech, where they'll say things in a, but it doesn't follow in like a line. They'll just say words. Sometimes at the severest level, they just blurt out words in any order. Sometimes they don't really say anything, because that's the other thing. They can get catatonic, where they don't speak, they don't move. And that's one of the more severe, that's an emergency, actually.
What can cause schizophrenia?
Schizophrenia, like all mental illnesses, are have they don't have an exact one cause. They know it's some genetic and some genetic component, like it's inherited, because people who are schizophrenic tend to have people who have other psychotic disorders or schizophrenia in their family, because there's a hybrid with bipolar called schizoaffective disorder, which is kind of somewhere in between. But the other things are environmental. So a lot of times schizophrenia comes on between the ages of 15 and 25, typically with men. And when women, they have a later onset, sometimes 25 to 35, but a lot of times it can be triggered by puberty. That's a big change in your body. Going to college and having stresses you never had before, losing a parent, losing a child, a divorce, those stressors can kind of push you across the line. But the other most common thing I see here, especially now, is like synthetic marijuana, methamphetamine. These things can push people directly over the line who may never have got there. They might have been a little strange, might be a conspiracy theorist. They might be a little like paranoid, like in the paranoid personality disorder or schizotypal personality disorder. But that stressor, that death, that something. And some people believe also that it's just your brain has some good connections that stop you from having a psychotic disorder. And as you hit puberty, you lose half of what you had when you got there, and then you lose another half of those by the time you turn 21, between 21 and 25. And if you lose the things that's stopping you, then the disorder tends to come on. That's why they tend to all come along between puberty and early adulthood, is because that's when you lose the most. That's the last time you lose a bunch of your nerve connections. They call it pruning. The thing about schizophrenia, the thing that they know the most as far as like structural, is this thing called the association cortex that's in your brain. It's kind of on this side of your brain. It's kind of more interior. And basically, I see you, you see a face. A person that's schizophrenic, they may perceive it as you having the face of a lion or a demon, because their association cortex, they don't see things the way we see it. They have the different, it's like they're looking through an alternative lens. Something simple as you reaching out to give them a handshake could then perceive your hand on fire trying to burn them, and they pull back. It's almost like they have different eyes and different ears.
How would you go about if your friend or a loved one has schizophrenia? How do you go about comforting them?
Okay, so the good thing about schizophrenia is most schizophrenic people feel most comfortable with people they know. So if they've known you their whole life, Most schizophrenic people don't make new friends. We assume we all experience the same thing. We don't know that. You can't know that. So one of the things I always tell people are sometimes you don't have to challenge the delusion, but maybe you could redirect it. Like, I know you feel like somebody's after you, but right now, can you just focus on being at Thanksgiving dinner? Or I know that you feel anxious about this, and if I was going through the same thing, I would probably feel the same. You don't necessarily have to say, hey man, that's not anything there. Because I always approach it as I don't know what you're experiencing. Also lower the stimulation in the environment. So if you're in a loud, crowded place and somebody's freaking out, then it may make it worse. The other thing I will tell you is this: a lot of schizophrenics live under the bridge, by highways, major streets, because they hear voices, but the noise cancels it out. One of my patients, her mother was schizophrenic, and they would come home and she's blasting grunge music and they wonder what's going on until she got older, and unfortunately she got sick as well, and she realized why her mother was doing it. It's because her mom was trying to cancel out. So sometimes they'll have their own ritualized things that they do. Other things are sometimes if they're not completely decompensated, once they realize and accept the fact that they have a mental illness, they're more likely to just be like, okay, cool, because they know that it'll keep them from going to hospital. It'll keep them from having to leave, because a lot of them don't want to leave wherever they are. So how they interpret how you sound, how they interpret your aggression, the volume, it's better to be calming, more neutral, not reactive when you're dealing with somebody that's in a crisis. Of course, the thing is, if there's a time when you think it's a danger to themselves or you, then the next step is to call 911. You can't wait. It's not even safe necessarily to even put them in the car and try to bring them yourself, because people jump out of cars while they're moving. It's a common thing that happens. It even happens out of ambulances. I've seen it happen in transport between one building and another at the hospital I work at. So the best thing is, if you feel unsafe and they feel unsafe, call the police. They'll send out an ambulance. I can't say there's a perfect record with handling a mentally ill, because as a person who works in this field, sometimes they come in and the crap's been beat out of them. But most of the time, the officers they send are for that purpose, so they know what they're doing. Try to keep them in a familiar place so they don't become more paranoid. Don't threaten them or tell them you're going to do something. Don't bring up the hospital. If you know that they need to go to the hospital, you call the police and all that. Don't bring it up, because you don't want them to run away and you don't want them to get upset with you. Even with people who aren't schizophrenic, if you talk really low and really calmly, it's hard for people to yell at you because they're arguing with themselves and they're not going to. They want you to give them something to work with.
Yeah.
What should people know about this disorder? What's the main thing?
The main thing is that you can live with it and have a productive life. There are doctors that are schizophrenic. There are PhD professors who are schizophrenic. It's possible, and it's just something that TV makes you think that these people are just they're going to wind up in the hospital or they just wander around. That is not true. You don't know all the people who are schizophrenic, because most of them won't tell you because they're ashamed of it, even though they shouldn't be, because it's not their choice. The biggest thing is, if they have support, proper health care, they have a psychiatrist, usually a psychiatrist and a therapist is best, and they have family that are supportive, they have very good outcomes. The other thing about schizophrenia is early intervention. The earlier you get treated, the better. The longer you wait, it's like if your phone drops in the tub and you have water on it and you continue to use it instead of putting it in the rice to try to dry it out, it's going to fry more. It's the same thing. Every time you have a psychotic episode, your brain is basically shorting out. So the less times that happens in your lifetime, you will have a better outcome. There's this thing called NAMI, the National Alliance for Mental Illness. They have a lot of resources for family. They do events, they do fundraisers, but they also do days, especially with people with children with mental disorders, but even people with older parents. They do a lot of advocacy, but they also do events to get people together. They do little tutorials. Their website is full of resources for whatever area you're in and tips about how to manage it, manage people there. And some of the people who are engaged with that, they tend to also, the families don't get burnt out because you're not the only person in the situation. Yeah. So it can really be helped even for the families to take care of themselves as well, because for you to be able to help this person that you love, support is important, and keeping them engaged, because isolation is bad for every mental illness that exists. Mhm.
Is it something that exists that is purely genetic?
So a longer explanation is this. Yes, it's yes and no. So when you're born, by your 3-year point, you have, well, when you're born, yeah, by 3 years, approximately, you have all the most neural connections you're going to have. You lose half of those by the time you're like school age or 12. Then you lose another half while you go through puberty, and then you lose another half that last pruning. That's basically that's who you're going to be. That's why they tell people don't drink and do drugs before you're 21. Partly, I would say as a psychiatrist, 25. Of course, I'd started drinking younger than that because I grew up in New Orleans. But the reason why is anything you do. So if you're exposed to toxic chemicals, if you're exposed to lead in your water, if you're exposed to traumatic events, like if you live in an abusive household where people are constantly has chaos, or if you are involved in if you're involved in things that like get your head hit in the head, different things like that. So anything environmental could be stressors. It could be physical damage, because I have patients who have syndromes that are like schizophrenia because they've had damage to their head. They've been hit in the head in a car accident, ejected out, or kicked in the head. I had a patient who got kicked in the head by a horse and then hit in the head with a brick by a neighbor. And he reminded me of the Green. Have you ever seen the Green Mile? He was just like that.
Yeah.
The thing is, so what happens is as you get older, you just have less safeguards. Like, so you start off with all these different connections. Some of them cancel each other out. But if you're left with the schizophrenic ones, by the time you get to the end of the race, that's how you get it. That's how it can get worse. But sometimes, like I said, early intervention limits how much those wires spread their effect into the rest of your brain. Because the earlier you calm that down, the earlier you can protect your brain. Because a lot of the meds we treat people with for mental illness are actually protective to the brain. So that's the thing about environment. Like if drug introduced, like I said, certain drugs, LSD, that's one of the things they use to model schizophrenia, because that's what a lot of the perceptions are. And a lot of hallucinogenic mushrooms with psilocybin, DMT, which they call ayahuasca. If you're a schizophrenic person, it's probably the worst thing in the world to ever put in your body, because they already have this. But if you turn it up to 1,000, it can be way more. It could be, and that's a sad thing, that sometimes these people will just be experimenting with drugs, and unfortunately, they pick the wrong one. So it's kind of, and it can trigger it too. But like I said, there's no one way somebody gets to it. There are people I know who start showing signs as early as 5 and 6 years old. And things. One of the things you also see in people in schizophrenia, they call it a prodrome. It's like things that start. Most kids who are going to grow up to be schizophrenic don't have friends. You ask them when they grow up, did you have a lot of friends? They'll be like, no. Did you care about not having friends? No. They're like, it's like they don't care about knowing people. So a lot of times their families will push them out to make them socialize, but they're not really interested. It's hard for them to form normal relationship. But the other thing is they're preoccupied inside. So the rest of what's going on out here is not so interesting. It's kind of like like I said, the extreme cases when they're catatonic. They're completely preoccupied internally, and they're completely turned out the outside world in certain ways. So that's one of the, like I said, it can lead to people not eating to the point where they get kidney failure and have muscles start to break down. And usually by that point, somebody brings them to the hospital. But that's the thing, like there is no one trigger, but there are triggers. So being careful with, don't put yourself through undue stress. If you think somebody has it in their family, they should stay away from drugs. If you have schizophrenia in your family, it's not worth it. You may never get there, but you don't want to try to get there.
What's the difference between schizophrenia and schizoaffective disorder?
Okay, so basically the difference between schizoaffective is there's two kinds of schizoaffective disorder. Schizoaffective disorder depressive type, and there's schizoaffective disorder bipolar type. So schizoaffective disorder, they have a lot of the similar symptoms to schizophrenia, but there's a mood component. Most schizophrenic people, even when they're hearing voices and stuff, they're not sad or depressed. You ask them how they feel, they're like, I'm okay. They don't really they're not depressed. They can be depressed like if their mom dies and they're schizophrenic, they can get depressed, but it's different from bipolar. They have the high highs and low lows. And some of the people who are schizoaffective, in addition to having those psychotic symptoms, they'll have mood episodes where they're manic, where they stay up for 5, 6, 7, 8 days. I've seen 30 days, 45 days without needing sleep. or they get depressed. And bipolar depression is worse than regular depression. It's like the deep, dark depression. I have a patient who said he stayed in the bed for like 6 months, basically, other than to go to the bathroom. The better thing to explain what the difference is. So schizoaffective people are psychotic all the time. Like they have the psychotic symptoms all the time, but they didn't have mood symptoms. But the psychotic symptoms don't go away. A bipolar person could become psychotic. There's bipolar with psychosis. They are only psychotic when they're depressed or manic. They're not psychotic when they're not either one. But what I would say about the schizoaffective, it's just they're in the same spectrum. They're all considered in the same spectrum. It's just that they have this mood component that is consistent. It's not situational. It's not because like something bad happens. It's because this just like people with depression, it just swoops in. You'll just be living your life every day and it swoops in. The good thing is the treatments for schizophrenia, especially the newer ones, cover both. So you can be treated with the same medication and have results for both disorders.
All right. Thank you.
Okay. That was a great answer. Oh my gosh. Dang. I actually feel like I learned something. All
It was
right.
very good indeed, yes.
I know. That was high yield. Dr. Turner, we appreciate you being really flexible with us. We appreciate it.
You're welcome. All right.
You have a good rest of your evening.